Okay. Mm. Today we are going to discuss about uh, the drugs, aminoglycoside, the class of drugs, aminoglycosides, and how it is working, and what are the benefits, and what are the advantages and disadvantages, like adverse effect and the therapeutic effects of aminoglycosides. Basically, the aminoglycosides are the drugs which are produced from some bacteria and extracted from bacteria, and they work on protein synthesis. They basically inhibit the formation of protein synthesis, and that may leads to in the bacterial cell wall, and that may causes the inhibition or the replication of the bacterial protein synthesis. By inhibiting the protein synthesis, this may affect the multiplication of bacteria and the division process, and acting as bacteriostatic and bactericidal type of effect based upon the dose and based upon the drug what we are choosing. So the first thing, aminoglycoside. Aminoglycoside, what is this aminoglycoside? These aminoglycosides are obtained from actinomycetes, particularly from the genus Streptomyces, except, so maximum all the aminoglycosides we get from this particular, obtained from this genus, except gentamicin. Gentamicin is another antibiotic which is used widely for so many conditions like gentamicin eye drops, ear drops, or maybe the tablet capsule, whatever, so based upon the requirement. And this is produced by the fermentation of uh, Micromonospora purpurea. And what is the property of these aminoglycosides? These are the drugs which are poorly absorbed by the GIT after oral administration. So during the time of oral administration, poorly absorbed drug, and they have poor penetration to the central nervous system. And it is showing bactericidal and more active in alkaline pH. So here, as we said over here in the previous slides, poor absorption the GIT. So here, because of that, like here, GIT, the pH will be higher. So here it is having, it shows the bactericidal effect, and which is in alkaline media where the pH is less. And these drugs, these aminoglycosides, are highly effective against anaerobic type of bacteria, anaerobic gram-negative bacilli, basically. And what is the good thing about this here? It is excreted out. It is excreted unchanged by the urine by a process of glomerular filtration. So it is removable by via urine and excreted out by the urine. And they have a low therapeutic index and narrow margin of safety. And the major issues with these aminoglycosides, what one can have, they exhibit an ototoxicity and the nephrotoxicity. Well, what could be like ototoxicity means issue with the ear toxicity where the balance may be disturbed or maybe in ear issues, and nephrotoxicity means the nephrons might get damaged and affects the renal filtration process or excretion process. So we'll see what which are the drugs which is involved over here and how they are acting. The classification is of aminoglycosides is divided into two different forms of aminoglycosides. The one which is systemic aminoglycosides, the one which is given to the body and get involved in the blood and shows the effect. And another is topical aminoglycosides, which is topically means applied topically on skin or on the wound, etc. So the systemic aminoglycosides are streptomycin, kanamycin, amikacin, tobramycin, gentamicin, cyclomycin, etc., and nitromycin. Whereas the topical applied, which is like here, this neomycin, it is like more commonly available in the powder form of a drug, powder form, and in some cases we may see in cream or in ointment. And pharmacetine. So these are the topical drugs which is used. And how they are acting. The basic idea, like how they are showing the bactericidal effect. Basically, these aminoglycosides, they are binding and showing the effect when they are in the cell via passive diffusion. Aminoglycoside enter in the cell through a passive diffusion via porine channel across this is the outer membrane. So we have seen in previously like the entry of the drugs from the various route inside the body of the bacteria and start showing the effect. So here this is going in the body by a porine channel, and that crosses and went inside the cell and activated, transported across the cell membrane by a cytoplasm by an oxygen dependent process. So this is an oxygen dependent process and inside the bacterial cell, streptomycin basically bind to 30S ribosomes, and the other aminoglycosides are binding to the 50S ribosome subunit and freezes the protein synthesis. So just basically to understand what is the protein synthesis and how this, in the normal case, how this protein synthesis would take place. If we see, if, say, suppose example, we'll just try to explain. Say, suppose this is the subunit, 50S, 60S subunit, and where the aminoglycosides coming in. In the normal case, what happened? There are two RNA, the messenger's RNA and the transverse RNA. Messenger and the transfer RNA, for example. So what is the process? Like here, for the development of the bacteria, we basically need a proper protein. Means, say, suppose example, to get multiplication or for the development of bacteria, we need a 7 amino acid protein or 11 amino acid proteins. So this is just an example for our explanation. I'm just giving. Okay, so 1, 2, 3, 4, 5, 6, 7. Okay, so we take 7 or 11. 11, we take 11. And this is a protein chain. 6, 7, 8, 9, 10, and this is 11. For multiplication or for replication, for some activity that has to be performed in the bacterial cell. So we required, say, suppose this much big amount of amino acid chain or the protein to show the effect, to undergo the process or helps in the bacterial development or multiplication or replication, whatever. So what this drug is doing, basically, this drug will block or inhibit the formation of protein, and it will break down the protein. Now the question is, how does this improper chain of protein is getting inhibited? So here, once the messenger RNA or the tRNA, where the amino acid comes and bind. Okay, and then from there it is forming an amino acid chain. So suppose something like this. So it is something like this. The formation of amino acid chain is taking place. And this amino acid will come over here and get joined in forming protein synthesis. So we are inhibiting, blocking the entry of the amino acid, and then this entry of the amino acid will be blocked. So this will be left an incomplete protein formation, and this is not useful. This is not useful for the bacteria for the development. And due to this process, the multiplication or the whatever the normal activity that has to for the growth of bacteria, that will be inhibited. So once that is inhibited, the bacterial growth is inhibited. The bacterial growth is inhibited. That means the multiplication, transduction, whatever the process is inhibited, and the bacteria cannot be multiplied. And that by this way, this drug is showing the aminoglycosides are showing the effect. So coming back to the slide. So here what we have said, inside the bacterial cell, the streptomycin binds to 30S ribosome, and whereas the other one which is binding to the 50S type of ribosomes. And the mechanism behind it is the protein synthesis is inhibited by aminoglycoside in three different ways. Interference with the initiation of the complex of formation of peptide chain. So here it is interfering the initiation of the complex, and misreading of the RNA, and break up the polysomes into the monofunctional monosomes. So here, if we see carefully these diagrams that shows over here, where it shows that the initial codon, which is 5S ribosome, and the 50S subunit, and the nucleotide change, where the mRNA is transferring the polypeptide change. But whereas in the case of treatment of aminoglycoside, when the aminoglycoside enters, it stops the formation and it's causing the miscodon of the peptide chain, where you can see this uh, square boxes, and that blocks the translocation. And by this method, this activity occurs more or less simultaneously and all over affect the irreversible or the lethal for the bacterial cell wall. So here, if this is in the normal case, the 30S subunit is there, and the 50S subunit is coming and binding to it, and this formation of the protein which is taking place over, okay, formation of protein which is taking place over here. So here, this is 30S subunit and this is 50S subunit. And this is in the normal case of where the protein is getting, and this is helpful for the bacterial cell growth. But whereas here it is blocking the binding, okay, and here this is missed codon. This is the the square boxes what I am talking about, and here this is causing the stopping the translocation. So interference with the initiation of the complex of the peptide. So here the first one, interference of the initiation of the chloride complex, and then it is causing miscodon peptide change. So misreading of or the breakthrough of the polymerase malfunctions that may, because of this reason, this bacterial cell wall is not stimulated or not properly growth, and that may leads to the overall irreversible process. So this process, once the aminoglycoside coming and binding to the in the bacterial cell where the protein synthesis and inhibited, and this causes the irreversible process. Because of that, this can be lethal. The cell death can be occur. Cell death means we're talking about the bacterial cell. the bacterial cell death will occur. So, and then that causes the mechanism. So that makes the cell of the bacteria death, and then if the bacterial cell is dead, means the bacteria is dead. Then the bacteria is dead, the infection, whatever the problem the one is having, is sudden, it starts going down and getting cured. So this is a basic mechanism. I hope you all understand. So here, this is 40S, 50S. So here, it's initiating the process of protein synthesis in this figure also. This is the first area, and blocking translocation, inappropriate incorrect amino acid binding, where the breakage of amino acid which takes place. And that is the factor that leads to that is the mechanism of aminoglycoside. And there are different ways this aminoglycoside that can a person get resistance to it. How does the bacterial get resistance to the aminoglycoside? The principal mechanism have been established to see that the receptor protein of 30S subunit ribosomes may be deleted or altered with the result of mutation. And in another case, production of the transfers of enzyme or enzyme inactivates the aminoglycoside by adenylation or acetylation or by phosphorylation. So here, these are the processes where the inactivation of these aminoglycosides takes place in the bacterial cell wall, and they are impaired the entry of aminoglycosides into the cell. So here, there is a third one where the aminoglycoside drug cannot able to enter inside the cell, and that is causing blockage. And the next one is the influx of aminoglycosides, the way the drug is entering without showing any action, the drug is coming out by efflux pump mechanism, what we have already understand in the antibiotics. And influx of this aminoglycoside, this can be inhibited by this mechanism where the normal ribosomes inhibition, the formation of normal ribosome inhibition took place. So this is the first one, and the second one, and the third one process. So by these three different methods, by three different mechanisms, these aminoglycosides are altering the absorption into the bacterial cell, and the bacterial cell get resistance to the aminoglycoside. So basically, if we understand the mechanism, whatever the mechanism is causing, so we just went back to the slides, and whatever the mechanism which is we see that obstructed by the formation of these aminoglycosides, the protein formation is inhibited, obstructed by the aminoglycoside, will be overcome in the resistance, and that may lead to the development of resistance mechanism in the aminoglycosides. Am I clear? So this is how the resistance will develop in the bacterial cell wall, and that may lead to the bacterial cell get resistance to it, and the drug is not having effect. And what is the clinical uses? This aminoglycoside is almost used in combination with beta-lactam antibiotic. And why we are adding with beta-lactam antibiotics, because to extend the coverage of this intruded potential with gram-positive pathogens, and to take an advantage of this synergism between these two classes of the drugs. And penicillin and aminoglycoside combination are used to achieve the bactericidal activity for the treatment of some conditions like enterococcal and endocarditis, and to shorten the duration of therapy in the case of streptococcal or the streptococcal endocarditis. So in the case of streptococcal bacteria or staphylococcal bacteria, this will shorten the duration of bacteria, shorten the duration of, the therapy, shorten the duration of therapy. So these are the clinical uses. And what are the adverse effects? So here there is the lot of adverse effects what has been seen with aminoglycosides. So this the first adverse effect, the most common adverse effect which is seen here with aminoglycosides is ototoxicity the problem with the hearing, and the nephrotoxicity with the kidneys. These are the adverse effects. So here, what is ototoxicity? The auditory damage resulting into the tinnitus and a high frequency hearing loss, and vestibular damage evident of vertigo, ataxia, loss of balance. So here what happened? A person, whenever he suffered with this ototoxicity, auditory damage, so there is some damage will be there in the ear, and the person will hear that tinnitus sound, means like a small beep like sound or ting. So that those type of sound will be, person will be hearing, especially the high frequency sound will be getting disturbed. And with other evidence that the patient may undergo vertigo, ataxia, or loss of balance. So there will be the improper, cannot able to balance, cannot able to walk properly, and there will be loss of balance will be there. And vertigo means feeling dizzy, and other issues can be happen to the patient. And streptomycin and gentamicin are the mostly cause vestibular toxicity, means that may causes the vertigo and loss of balance to the patient. The other adverse effect is like nephrotoxicity, means what do you mean by nephrotoxicity? Here we mean that it is damaging the kidney. Nephrotoxicity results in rising serum creatinine level. So here, what is the normal range of creatinine level is here 0.1 or something till 1 or 1.2. And then that creatinine level will get disturbed and reduce the creatinine clearance. How it is, the creatinine level will be increased, rises, because it is reduced. The creatinine is not excreted out from the body, and the amount of creatinine will be increased in the blood, and that may result in renal damage. The drugs like neomycin, tobramycin, and gentamicins are the most common to cause of nephrotoxicity when these are used systemically. So that's why like gentamicin is like more commonly given in drops or for ear drops or eye drop type of condition in the eye infections. An aminoglycoside with a high dose can produces a cure-like effect, which is non-muscular blockage, and that results in the respiratory paralysis. So non-muscular process, that means it is where the patient is having relaxation type of muscles, and then it will cause issues. Next is precaution and the interactions of these aminoglycosides. What is these precautions? These aminoglycosides cannot be given to the patient who is like during the time of pregnancy, because that can causes a fetal toxicity. Risk of fetal toxicity can be toxic to the fetus. And avoid concurrent use of ototoxic drugs like nephrotoxic, high ceiling diuretics, monocycline, vancomycin, cephalosporin, and cisplatin. So there's some drugs which is diuretic, some drugs like vancomycin, cephalosporin, higher, and antibiotics, and cisplatin, which is anti-cancer treatment of a drug, anti-cancer drugs. In that case, this can cause ototoxicity and nephrotoxicity. And special care has to be taken in the case of patient if we don't have any medication to prescribe. So if we are prescribing aminoglycosides, if the patient who is having a renal damage, so any issue with the kidneys, kidney damage, then those patient has to be avoided. And another caution should be to have muscle relaxant in the patient receiving aminoglycoside. So here, caution of muscle relaxant. The next topic is so here this is about how does these aminoglycosides are acting and what are the clinical uses and the adverse effects. So basically it is interfering the formation of protein chain, of inhibiting the protein synthesis by 3 different mechanisms, and resistance development by 3 different mechanisms, and clinical uses and adverse effects of these aminoglycosides. And precaution has to be taken during pregnancy, during if a patient is taking any one of this medication which is given like high saline diuretics and etc. And if patient is having a renal damage, and in the case of patient is receiving some muscle relaxants in the case of aminoglycosides. Combination of these drugs has to be avoided to avoid any interactions of the cell. Next is antifungal drugs. What is fungus? The antifungus. The fungal infection is a issue in the pharmaceutical. When we are prescribing any antibiotics, there are some patients maybe we might come across that whenever any antibiotic is prescribed to these patients, they come up with the fungal infection. The fungal infection can be in the case of oral, or can be of peripheral or superficial fungal infections can be seen. And in those cases, we required antifungal drugs to overcome these fungal issues. The fungal infection is basically caused by the fungi, and that is commonly exist in the environment. And this infection is usually a superficial that involves over the nail, hairs, and skin, and sometimes it can be in systemic also. And common type of fungal infection is associated with like athletic foods and fungal nail infections. What is athletic food? Athletic food means here a person who is like wearing like socks, shoes a lot, and excess of sweating. Because of the sweat excess, the blisters and the formation of wound that might occur to the patient on the nails in this area. So that is something athlete food. So it could be because of excess of sweating, and the person starts get itching sensation, strong itching, and cracked skin that might result into the athlete foods. This is basically because of unhygienic condition, possibly many times because like wearing in hot weather, excess of sweating by the foot, that can also lead to this one of these conditions. And fungal nail infection means the toenails. The nail can be any nail. The toenails are basically the fingernails become thick, and these become discolored and become crumble, and sometimes brittle, with pieces of the nails will break more often. So this could be because of some formation of fungus into the nails. Another fungal issues where we required antifungal drugs is the ringworms. The ringworms, which causes red shape on the skin, on the body, and the scalp. So it can be anywhere in the body, the rashes, or will be in the scalp. Vaginal thrush is like irritant that is swelling, and the vaginal and the valvular invasion of this fungal infection are less common but more serious. These infections can occur deeply inside the body tissue or on one of the organs, like such as brain and lungs. And most fungal infections are treated by topical antifungal medications, and are very extensive for the serious infections which will be given oral antifungal drug. And the control disease is to prevent recurrence, and good personal hygiene is one of the factors that has to be taken care of to overcome or to stop getting any fungal infections. So based upon the type of fungal infection and where it is present in the body, the treatment will be decided by the physician to overcome that fungal infection. Say, like suppose in some cases, like an example of lungs, like a person is suffering with fungal pneumonia. The pneumonia is something where it is affecting the lungs, isn't it? The patient having a fluid accumulation is a normal pneumonia, and if it is a fungal pneumonia, the fungus growth will be there in the lungs, and that is something called fungus pneumonia. And if suppose that is the condition, in that case, we have to give a treatment. Systemic treatment means we have to give oral antifungal tablets. But whereas if the fungal infection, like what we have seen, like in ethylene foods, or maybe in the vaginal thrush, or maybe anywhere in the body that is associated, then an topical applied fungal cream, fungus cream, or the fungal cream, or the powder form of a drug will be given to the patient to overcome this condition. And the best thing is to overcome this condition is like good personal hygiene. And the antifungal drugs, what are present antifungal drugs? Here, polyalene that interacts with ergosterol in the fungi. So here it's talking about the formation in the ergosterol, which is there in the fungi, and from the channel through which a small molecule leaks inside the fungal cell and the outside. And here the drug which is given is amphotericin B, the short form is AMB, and nystatin. And azoles is an inhibitor that is inhibiting the ergosterol biosynthesis by a cytochrome P450 in liver. Cytochrome P450 is a liver enzyme. And the drugs like cotrimazole, fluconazole, itraconazole, and ketoconazole. So here, this cotrimazole is a drug which is coming. The brand name is Canesten for fungal cream. So here, 1% or the 2% of cotrimazole, which is used for, like suppose example, ethylene foods, or maybe for vaginal thrush, like out superficial. Other than that, like it could be fluconazole, itraconazole, or ketoconazole. Even this, like ketoconazole and itraconazole, are fluconazole are available in the ointment or in the form of cream, and fluconazole and some tablets is also there, like ketoconazole and fluconazole, 4 milligram tablets. If there is, I think 4 milligram, yes, 4 milligram tablets based upon the type of fungal infection. It will be given like regularly means once daily, twice daily, or maybe weekly, once or twice, based upon the condition. The another form of a drug that is affecting the ergosterol biosynthesis by sequel epoxidase process, that is terbinafine. An antimetabolite drug that is affecting the DNA and the RNA synthesis of the fungus, that is 5-fluorocysteine. And other will be grisofluin. So grisofluin. And how does this antifungal drugs like amphotericin B is acting, which is like more widely used drug, which is in the case of fungal infection. In the case of fungal infection, of how this is acting, it acts against the wide range of molds and the yeast, and it is administered. This can be given topically, applied topically to the patient on the skin, and it will be given IV. And this has a poor cerebrospinal fluid penetration. Here, this amphotericin B interact with hydrophobically with ergosterol in the fungi cell and membrane forming the pores. And these pores, the potassium and the other small molecule lost through the pores and causing the cell death. So here, basically, this is opens the channel of potassium of the fungus, and where the excess of potassium will be removed out from the fungal cell body. And then that may leads to the death of the pores and the cells. And these drugs, like in the case used in amphotericin B, is used in the case of oral fungal infections and vaginal thrush and cutaneous candidiasis and otomycosis, which is used topically. And in the case of systemic meiosis, it is a golden standard drug for antifungal therapy for inpatient especially, and because of the higher toxicity of the azoles and antifungals are preferred. Leishmaniasis is most effective drug in the cases of resistance to the case of Kala Azar. What is leishmaniasis? It's caused by a bite of sandfly, that is Kala Azar type of leishmaniasis, and were also called as the black fever of Kala Azar. This Kala Azar is characterized by irregular bout and the fever sustained with the loss of weight, swelling and of the spleen and the liver, and may lead to anemic conditions in the patient. And if suppose the rate of death, I think the disease is, if suppose if it is this leishmaniasis, if suppose this is not treated for a while, where it is fatal also in some cases. Like if it is left it like that and untreated, may lead to the like uh, maybe in 1 or 2 years the patient will be reaches the fatal condition if it is left it like that and untreated basically. So this is about amphotericin B. So it is used in systemic as well as oral. So here, when we say orally, means like suppose what I mean here, I mean here like a gargle, like suppose oral fungal infection in the mouth or in the gums or someplace or in the skin inner lining of the mouth. In that cases, a gargle or rinsing will be done. Adverse effect of this antifungal therapy is like toxic here. The toxicity is very high and acute reaction that each infusion consists of chilling, fever, aches, and pain all over, nausea, vomiting, and dyspepsia. So when this is given to the patient, there is a possibility that patient may suffer with chilling and like high shivering will be seen at the high body temperature, and feeling like was nausea and vomiting feeling will be there for this type of patient in this treatment. The other long-term what do you call adverse effects or the side effects, where the long-term toxicity usage, long-term usage of these drugs may cause severe adverse effects like nephrotoxicity, damage the glomerular nephrons, and progression to the anemia. So here again, it is acting on the where the development of the RBC and WBC RBC will be getting disturbed because due to the bone marrow depression. So long-term toxicity, if it is given for a longer period of time, this may lead to this type of conditions. Another antifungal drug is nystatin, which is used in the case of oral thrush or the denture stomatitis and the antibiotic-associated stomatitis. So here, antibiotic-associated stomatitis means there's some patients who are taking, say, suppose example, amoxicillin, and flare up with they flare up with this fungal infection orally, and that may be result and this nystatin will be given in like from I think 1 ml is containing 1 lakh IU unit, 100,000 IU unit, or 10,000 IU unit. So based upon the dose, it is given 1 ml or 1 ml to 4 ml. Rinse in the mouth twice or thrice daily based upon the condition. And corticosteroids associated oral candidiasis and uh, mucocutaneous candidiasis in the lips. Used topically for high toxicity and not absorbed orally. So nystatin, which is used for oral purpose or the topical purpose, not it is used orally. So when in the case of oral thrush, it will be like rinsed in the mouth and then it will be spitted out. Okay. Antifungal drugs, other drugs are ketoconazole and cotrimazole, which is like these are the drugs which is like more commonly used as a topical application and used in the treatment of fungal infection where the other treatments has been failed and contraindicated. So suppose the patient is having some issues some issues with contraindicated with other drugs or maybe some other medication, or in that case, this ketoconazole is used. It is used hepatic and the liver function test has to be monitored with this condition. So here the liver function test LFT has to be monitored because it is damaging the liver. Incident is significant where 1 is to 1,500. So here that may out of 1,500 patient is having a possibility to develop hepatic or the liver impairment and causes a rise in LFT readings, damage to the liver. Cotrimazole is replaced amphotericin B in managing certain type of systemic meiosis and useful in topical applications. So cotrimazole is 1% available in the hospital, 1% or 2%. Okay, and there are many more, like say suppose percentages are available, but like more common is available in 1% or 2% for fungal infection. And this drug is applied topically, is used especially in cases of genital region infections, which is caused by candida or vaginitis, which is caused by fungal infection. This could be a normal fungal infection when someone comes in contact with the fungi directly, or by this could be because of an antibiotic flare up causing fungal infection. An infection of leukorrhea caused by yeast fungi, this can be used in the treatment. Cotrimazole can be used for this condition. Ozoles are avoided during the pregnancy and during lactation period. So because it has some different, it can damage kidney and other issues. Another antifungal drug which is used here is 5-fluorocytosine. These are used as other antimetabolites. This emerges the drug resistance and the problem. And therefore, it is seldom to be used alone. And used in combination with amphotericin B and treatment of the choice for cryptococcal meningitis and effective against the number of other microsomes. Antifungal drug like Grisoflovin, it is acting on DNA, like here we have seen, and choice of in the case of chronic infection or the nail infection, and administered orally and inhibit the mitosis of fungi. So we have seen here. This is about antimetabolites 5-fluoro, which is acting on DNA. I got confused. Okay, I'm sorry. This is acting on DNA and RNA, and this is about affecting the multiplication of the fungus during the period of mitosis. So here, if it's in this case, and here it is getting blocked. So the multiplication of the bacterial, fungal cell will be inhibited. Okay, the next topic is, so this is something about antifungal drugs. So generally, in the case of fungal infections, all the drugs which is, and this glucoflovin is a choice of drug, comes in the liquid form, which is applied topically in the case of fungal nail infection. We have just seen a fungal nail infection here in the slide 1, where the nails will get brittled, and we have seen here this is the area of fungal infection. The nails are getting brittle and curdle, crumble, and brittle. So here this is, in this case, this the glucoflovin drug will be given, not given, it is applied topically on the nail. So suppose this is in the case of nail, applied topically on the nail, and for at least 4 to 6 weeks, okay, to overcome the fungal nail infection. And if suppose in this treatment, like here, we have to be careful about if the treatment is done for more than 8 weeks or something, then the treatment has to be stopped for some time, like suppose 3 to 4 weeks, and then again we have to restart the treatment. If suppose the complete cure has not happened in the case of fungal nail infection, then the drug has to be stopped for some time, like for 2 to 3 weeks, and then again restart the treatment for again 8 to 12 weeks. And this is applied topically on the skin. Antiviral drugs. What is antiviral drugs? As the name indicates, these are the drugs which is used in the case of viral infection, and these antiviral drugs are classified under different categories, classified under anti-herpes virus, anti-retro, and anti-influenza virus. And the drugs which is classified over here in anti-herpes virus is idox, idoxuridine, acyclovir, vancomycin, famiclovir, and ganiclovir, and others. And antiretroviral drugs like nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. So here this is nucleoside reverse transcriptase and this is non-nucleoside reverse transcriptase inhibitors. This is something here and this is something here. And the drugs like zidovudine, lomovidine, dinovidine, etc., and noriven, etc., protease inhibitor, retinoidovir, indinavir, nelvenivir, and anti-influenzal virus drugs like amantadine, rimantadine, olcitavir, zanimavir, etc., are the drugs. This antiviral treatment is given to the patient based upon on the what I was telling. This antiviral drug is given to the patient based upon the infection condition for the patient. Infection means the viral infection we're talking about, and this will be given as a single dose very rarely, but it is given more commonly in the combined dose. Combined dose means like 2 or 3 different class of the drugs are combined together to overcome the viral issues, viral conditions that maybe arises to the patient. So the antiviral drug like acyclovir, which is a class of drug which is anti-herpes virus condition, anti-herpes. So this anti-herpes type of drug, acyclovir, how it is acting? It is acting basically by a herpes virus specific infection, and here acyclovir triphosphate that inhibits the viral DNA polymerase competitively and gets inappropriate viral DNA, stop lengthening of the DNA, and terminate the DNA inhibiting polymerase irreversibly. The acyclovir is the application of antiviral drug in the dentistry is restricted. So here the drug is restricted for the treatment of oral pharyngeal herpes and simplex as the herpes labile that occur particularly in the immunocompromised disease patients. So in immunocompromised patients, this condition, but here in the case of dentistry, the use is restricted. But here dentists run a risk. So here because they are directly come in contact with the patient and the blood, like say suppose example, how you come in contact with the blood of a patient when during time of extraction, during time of cleaning, or RCT, root canal, and other conditions. So here, in those cases, this conditions may be problematic. So here the accidental risk of HIV conditions so should be informed to the patient and the dentist should be well informed about the prophylaxis so to avoid any direct issues. Acyclovir triphosphate interferes with the DNA polymerase that inhibit the DNA replication. So what we have seen in the figure over here, it is binding the DNA lengthening and polymerase competitively and stops the lengthening. Means like, what do you mean by lengthening? Means if suppose the DNA is shorter, it's when it gets lengthened, when during before it has to get divided, means multiplication. So here it's inhibiting the lengthening process of the viral and inhibit the replication of DNA. And this viral chain terminates and follow up the inappropriate into the viral DNA. And acyclovir is only partly 20% absorbed via gut. And the mechanism of these antiviral drugs, like how they are acting over here, if you see, we have like some figures. The different class of these drugs will acting differently based upon their mechanism. Like say, suppose this HIV virus replication in the DNA acting. Like say, suppose the HIV virus attaches to the helper T cells and C4 codon of the protein, and viral DNA reverse transcriptase enters into the cell. And then when it is enters into the cell, this viral DNA go and bind with the RNA and the DNA copy. And so it's making a duplicate copy of the DNA. And thus it goes into the plasmid inside the nucleus and undergo multiplication. And the drugs like, and then it makes HIV protein, and this may lead to the formation of protease protein that will interact with the proper size, and the cell is killed and virus leave the infected new cell, and virus leave outside and go and infect the new cell, and the new viral particle are assembled. So this is a basic process, and the drugs like reverse transcriptase inhibitor and the protease inhibitors are blocking this area 3 and area 7 formation. Non-nucleotide and the nucleotide reverse transcriptase drugs like antiviral drugs like some what are those drugs like zynodovine and lamivudine and like ritonavir, skinavir, indonavir. Okay, so these are the drugs which, say example, they inhibit the viral DNA and formation of DNA change process. And this will obstruct. So here this DNA and this RNA. So let me see, this DNA and RNA is getting blocked over here. And then it causes the inhibition of this inhibitor bind the reverse transcriptase denture, and then the viral DNA will be left alone with enzyme cannot produce a viral DNA. So here the way the enzyme cannot induce a different viral DNA. So the infection is not proceed or not goes into the another cell. The antiviral drugs are like zidovudine, azidothymine, or AZT, and it is used asymptomatic treatment or the symptomatic treatment in the case of HIV disease. And zidovudine decreases the progression of prolonged HIV infection in the patient, and increases the life of HIV infected patients. And adverse effects can be anorexia and nausea, headache, abdominal pain, myalgia, anemia, insomnia, and neutropenia, convulsion, and encephalopathy. So this could be the adverse effects of this condition. The next drug is lamivudine triphosphate. It may be used prophylactically in the healthcare workers to avoid, like if somebody is working in the coming in contact with HIV patients. So it's used prophylactically to avoid the risk of acquiring the HIV infection. So this is used prophylactically. On exposure to the virus in the combination with zidovudine in the treatment of HIV infections. And the the phosphate inhibitors are protease inhibitors. In this case of protease inhibitor, the drugs like acting on the late stage of HIV replication. So we have seen in the figure where it was binding to the late phase over here, phase 7. But whereas reverse is acting on the phase 3. So it is acting on the late phase on the protease inhibitor. And these protease inhibitors bind to a protease molecule and interfere the cleaving of function. And they are more effective in the viral inhibitor than AZT, like what was AZT? Zidovudine drug. And this zidovudine, and because they act in the last step of the viral cycle, they are effective in both newly as well as the chronic infection. So here it can be used in chronic or the acute or the new or the older infections. Under the influence of HIV infection cells, the process is immature, non-functional viral progeny and hence prevent the further round-up of infection. In dentistry, the plasma level of metronidazole and lidocaine, midazolam, carbamazepine can increases by protease inhibitor. So here, if a patient is taking this protease inhibitor, so here the level of plasma level can be increased of this medication like metronidazole, lidocaine, and midazolam can be increased by protease inhibitors. This is a tabular form of which is a preferred regime of the treatment which is to be prescribed to the patient based upon the severity or the use of condition of HIV infection, where the low risk and the high risk patients, where the source if HIV positive has but asymptomatic low HIV mRNA or symptomatic AIDS patients. So here a combination of nucleotide reverse transcriptase and the non-nucleotide reverse transcriptase drugs like zidovudine or lamivudine or efavirenz is given, and a combination of nucleotide reverse transcriptase with protease inhibitors like lipopirnavir and lamivudine and zomivudine. And both PI sparing alternative regime which was given in an alternative fashion to the patient. So based upon the patient's severity and patient condition, one of the regime will be given to the patient to overcome the HIV condition. So this is all about the drugs like antifungal, antiviral, and the aminoglycosides. And so basic thing is about how to take precautions and how we can treat the patient who are coming with this type of infections. Okay, thank you very much. And if you have any questions or anything after you listen to this, then we can discuss this in the class later on. Okay, thank you.